My name is Anthony Kohn, and this time I will talk about hypogammaglobulinemia. Definition: Hypogammaglobulinemia is a condition in which the level of immunoglobulins, antibodies, in the blood is low and the risk of infection is high. It's a problem with the immune system in which not enough gamma globulins are produced in the blood.
Good morning, Ms. Samuel. It's so good to see you again.
Good morning. Good to be here.
Well, I can see from the records that your doctor sent that there's still been some problems with your sinuses. And there's also a test that's abnormal that there was some concern about.
Right. I've had at least 3 sinus infections since the last time we met. And so my primary care physician put me through a battery of tests and came up with an idea that he thought I needed to talk to you about. Something about gamma globulin. I've looked it up on the internet, and it's very interesting. He thinks that my immune system is compromised, and I'm extremely worried about it.
I can see that would be a big concern. It would be a concern to any of us. Our immune system is critical to our survival. It keeps us from getting infections and cancer. And of course, it would worry you if you thought your immune system wasn't functioning very well. But I also think it's important to understand that the tests that we use for your immune system are not as black and white as you might think. And just because it's abnormal on paper doesn't really mean that your immune system is abnormal.
Really? I'm interested to hear about that. I'm very worried, really.
And again, I can understand that, but I just want you to keep in mind that just because the number is low doesn't mean that your immune system is not functioning. Immunoglobulin has a wide range of normal. Wide range. Almost 10, well, double. You can be double and still be normal. And so when you're a little bit below normal, that really probably isn't significant. Now, I'm not saying we'll ignore it. I think we will need to do some additional tests. Because I think we can assess your immune system better if we gave you a vaccination to measure your immune system's ability to respond. It would be like looking at a symphony orchestra. Instead of just counting the people on stage, let them play a chord and see what it sounds like. And we might find that even though the numbers may be a little bit below the average number of players, they do a pretty good job.
Well, the thing is, I've had all these sinus infections, and my insurance will pay for this test. It sounded really good online, or this treatment, I guess it is.
You're talking about the gamma globulin.
Yeah.
Well, and it is expensive, and I think, though, it's important for us to talk about the side effects possibly, too.
Oh.
And actually, there's a source here from Consumer Reports that you might want to go to that gives you some of the background about gamma globulin. Gamma globulin therapy is life-saving if your immune system is not functioning. But when it's just barely at the edge of being normal, it actually may have enough complications to make it not a good idea to give.
Oh.
It can cause fever, and it can affect your kidney, and there's even been people who have stroke-like conditions, and it's made from human plasma, pooled plasma from hundreds or thousands of people put together and pooled. Now, we screen to make sure it's safe, but it's still a little bit unnerving to be getting that. So I don't think we want to rush in to gamma globulin treatment. I know you've been having symptoms. I understand that bothers you, but I think if we treated your allergy just a little bit more aggressively, if we looked into the allergy, we might be able to control the symptoms. But at the same time, we'll look into your immune system to make sure there's not a problem.
Application in medicine. Doctors treat bacterial infection with antibiotics. People who get severe or frequent bacterial infection may need to take antibiotics for several months at a time to prevent them. If your hypogammaglobulinemia is severe, you may get immunoglobulin replacement therapy to replace what your body is not making.
Hi, I'm Dr. Andy Thompson, and I'm a rheumatologist. Today, I'm going to talk about intravenous immune globulin, or IVIG, for the treatment of rheumatic disease. You can visit our website, www.rheuminfo.com, and print off one of our IVIG picto pamphlets to follow along with this video. Intravenous immune globulin is also known as IVIG. Now, IVIG is given by an intravenous infusion every month. Each infusion can take from 2 to 6 hours to complete. The infusions are given by a specially trained nurse at an infusion center. Now, some people can feel better quite quickly after starting IVIG, but for others it can take a little longer. Now, there are 2 things you need to do when taking IVIG. You should discuss these with your doctor. First, you should have regular blood tests while taking IVIG. This is important to keep track of your disease and make sure your blood counts, kidneys, and liver are okay. Second, you should call if you develop a fever. IVIG is a blood product and there is a risk of getting an infection. People donating IVIG are carefully screened to lower the risk of infection. IVIG can rarely cause an allergic reaction during the infusion. Now, you'll be given Tylenol and Benadryl before each infusion. Some patients have developed a fever and flu-like symptoms during an infusion, including feeling out of sorts, chills, fatigue, and weakness. Other patients have reported shortness of breath or chest discomfort during or shortly after their IVIG infusion. This is due to fluid buildup. Let your doctor know if you feel unwell when receiving the infusion. Headache is one of the commonest side effects to IVIG. Now, most headaches go away after 24 to 48 hours. IVIG can induce migraine headaches, and it can very rarely irritate the lining of the brain. IVIG can cause an increase in blood pressure. Your doctor will monitor this, but tell your doctor if you have high blood pressure. IVIG can also cause a rash. IVIG has been rarely associated with an increased risk of blood clots, and other vascular problems such as strokes and heart attacks have been reported in patients receiving high doses of IVIG. If you're receiving IVIG, you should call your doctor if you feel sick and want to stop, or if you're concerned about any side effects. For IVIG, there are other specific reasons to call your doctor. If you have a fever or think you have an infection. If you develop a severe headache. If you feel short of breath or develop chest pain. If you develop a rash. Or if you notice new swelling in a leg or an arm. I hope you found this video to be useful. For more information, please refer to our website at www.rheuminfo.com.
Pros and cons. Pros: recurring infection with Streptococcus pneumoniae or Haemophilus species, infection with a typical pathogen, repeat antibiotic use. Cons: young children and early adulthood, primary disease, old age secondary disease, male sex, positive family history, or primary immunodeficiency.
Hi, my name is Dr. Benjamin Prince, and I am an allergist immunologist at Nationwide Children's Hospital in Columbus, Ohio. And today I'm going to talk to you a little bit about when to consider starting immunoglobulin replacement therapy. So before we go there, I want to talk to you just a little bit about what immunoglobulin replacement therapy is. Immunoglobulin replacement therapy is something that's been around since about the 1950s and is actually pooled antibody from various healthy individuals around the world that's then screened, purified, and given to patients that have antibody deficiencies. Antibodies are actually specialized proteins that are really important for your immune system to function, specifically the part of your immune system that's called your adaptive immune system. They're actually made by cells called B cells, and they help identify invading pathogens, bacteria, viruses, fungi, and help other parts of your immune system clear those pathogens more effectively. They're also the protein and the part of your immune system that we take advantage of when we're administering vaccinations to both children and adults. And they're very, very important in protecting us from diseases. In patients that have antibody deficiency, they typically present with recurrent or severe sinopulmonary diseases. So these would be recurrent sinus infections, ear infections, recurrent pneumonias. They can also get blood infections, tissue and bone infections, and even suffer from certain kinds of severe diarrheas. If your doctor suspects that you may have an antibody deficiency, they will likely send you to be evaluated by a specialist, specifically an allergist immunologist, who will take a detailed history of the kinds of infections that you've had previously. And if they think that you may have an antibody deficiency, they will send typically blood testing looking at the various classes of antibodies that you make, as well as the quality of that antibody. They may also look at the cells that we previously discussed called B cells and characterize those cells to see if there might be any issues with the different populations that you make. In patients that have either low antibody levels or that have poor function, assessed by responses to various vaccines, your doctor may prescribe an antibody replacement therapy or immunoglobulin replacement. There's a couple different ways that the immunoglobulin replacement can be administered. Historically, we often would give it intravenously, either in the hospital or an infusion setting. But more recently, other therapies that are used to administer it subcutaneously have been used that make the replacement much more convenient and can occur in the confines of your own home. Immunoglobulin replacement therapy is a therapy that has really revolutionized the treatment of patients that have antibody deficiencies or other combined immune deficiencies. It's well tolerated and can help protect them from infections that otherwise they would succumb to. If you're concerned about a primary immune deficiency or a primary antibody immune deficiency, or if you want more information, I would encourage you to seek counsel from an allergist immunologist or visit the Quad AI website or other websites that have lots of detailed information about immune deficiencies, such as the Immune Deficiency Foundation. Thank you for your time.
Isai applied in Ecuador. The pathology of the parasitosis has been related to the presence of hypogammaglobulinemia, mainly secretory immunoglobulin E deficiency. Some cases of severe giardiasis have been associated with the presence of lymphoid nodular hyperplasia in the small and large intestine.
Hypogammaglobulinemia is a disorder in which the body's immune system does not make antibodies or makes a reduced amount of antibodies. Hypogammaglobulinemia has a variety of causes. The most common causes are primary immune deficiency, usually the result of a genetic mutation which prevents the immune system from making antibodies. Hypogammaglobulinemia symptoms: sinusitis, bronchitis, pneumonia, conjunctivitis, cellulitis, abdominal abscess, skin abscess, gastroenteritis. Hypogammaglobulinemia treatment. The most common treatment for hypogammaglobulinemia is regular injections of IgG immunoglobulin, also known as gamma globulin. This is an antibody preparation which is extracted from donated blood. Gamma globulin contains antibodies extracted from people who have been vaccinated against or exposed to common diseases such as mumps, chickenpox, influenza, and bacterial infections. These antibodies provide what is known as passive immunity. It is passive because it has not been generated by the recipient's own immune system. Hypogammaglobulinemia is a common disease, yet every individual needs unique treatment and care. We encourage people with hypogammaglobulinemia and their families to learn, as much as possible, about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about hypogammaglobulinemia and how to treat hypogammaglobulinemia, just click on the link at description or visit www.mainmd.com. Thank you.
Conclusion. Symptomatic hypogammaglobulinemia in childhood may be the initial finding of primary immunodeficiency (PID), or may be due to delay in maturation of immunoglobulin synthesis.
My name is Colin Heidman. I'm from St. Cloud, Minnesota, and I was diagnosed with hypogammaglobulinemia. So the teen escapes are really fun. It's pretty much anybody above the age of 13 to 20 gets to go, and you just kind of get to hang out for the first couple minutes, just get to know everybody around you, and it's great getting to meet other people that are like you, because before teen escapes and IDF, I felt like I was the only one of the only people that had my disease, but going to these events really helped out. The Teen Escape, you do a lot of fun stuff. You do activities, you go to Dave & Buster's. Sometimes you just get to hang out and meet new people and make friends. I've gone to the Teen Escape twice, and I am becoming a teen council member next year, so I'll get to go to a couple more before I'm 20. And then you do have to sit through some conferences and learn about your immune deficiency, but they're helpful and they help you learn, and they kind of just branch off of what you're taught in the normal stuff, because even in the games they might be themed to teach you something, but in these, some have helped me figure out how I'm going to deal with college, either if I'm moving away or staying home, and how to deal with it if I do move away. But a lot of fun stuff. Would recommend it. One piece of advice I'd give to somebody who's just diagnosed is don't worry about it. It may seem really bad at the beginning, just finding out, but it does get better. And there are people out there ready to help, and they will.
Thank you.